Welcome to another episode from the Veterinary Medicine Digest. Hello and welcome. Today, we're diving deep into a topic that nearly every dog owner will face: the decision to spay or neuter their beloved canine companion. For decades, this procedure, known medically as Gonadectomy, has been presented as a cornerstone of responsible pet ownership, a straightforward choice with clear benefits. It's often framed as a simple solution to the heartbreaking problem of pet overpopulation, a way to prevent certain diseases, and a fix for unwanted behaviors. But as veterinary science evolves, so does our understanding of the profound and lifelong impact that removing a dog's sex hormones can have. The conversation is shifting from a universal recommendation to a much more nuanced, personalized discussion between veterinarians and pet owners. Recent research has uncovered a complex web of risks and benefits that vary dramatically depending on a dog's breed, sex, size, and the age at which the surgery is performed. What might be the best choice for a tiny Yorkshire Terrier could be detrimental for a majestic Golden Retriever. So, today we're going to untangle this complexity. We'll explore the traditional reasons for neutering, but we'll also venture into the cutting-edge research that raises critical questions. We'll talk about cancer, how neutering can drastically reduce the risk of some types, while potentially increasing the risk for others. We'll examine the surprising effects on a dog's bones and joints, especially in larger breeds. And we'll tackle the often misunderstood topic of behavior, separating fact from popular belief. This isn't about telling you whether you should or shouldn't neuter your dog. Instead, our goal is to arm you with the most current, evidence-based information from the scientific literature. We want to empower you to have a truly informed conversation with your veterinarian, to weigh the pros and cons, and to make a personalized decision that is right for your individual dog, your family, and your lifestyle. This is a journey through the science behind one of the most common veterinary procedures, and it might just change the way you think about spaying and neutering. Let's get started. The foundation: population control and reproductive health. To truly understand the modern debate around neutering, we first need to look back at why it became such a standard practice. The primary driver, especially in the United States, has been the persistent and tragic problem of pet overpopulation. Dogs and cats are incredibly prolific. They are multiparous animals with short gestation periods, meaning they can produce numerous offspring who themselves can reach sexual maturity in as little as 6 months. This biological reality, combined with a lack of responsible pet ownership in some cases, has historically led to an overwhelming number of unwanted animals. Shelters became flooded, and euthanasia was, for a long time, the sad and frequent outcome for millions of healthy, adoptable dogs. In this context, widespread spay and neuter programs emerged as a logical and humane solution. The logic is simple and powerful. By surgically sterilizing dogs before they have a chance to reproduce, we can prevent the birth of unintended litters and drastically reduce the number of animals ending up in shelters. Animal shelters, often legally required to neuter animals before adoption, began performing the procedure on very young puppies to ensure compliance and break the cycle of reproduction. This approach has been a cornerstone of population control efforts for decades and is credited by many with significantly lowering euthanasia rates in shelters. Beyond population control, gonadectomy was championed for its direct health benefits related to the reproductive system. When you perform an ovariohysterectomy, or spay, on a female dog, you remove her ovaries and typically her uterus. This, quite obviously, eliminates the risk of ovarian and uterine cancers entirely. More significantly, it offers protection against a very common and life-threatening condition in intact female dogs: pyometra. Pyometra is a severe infection of the uterus, and studies from countries where spaying is less common, like Sweden, have shown that nearly a quarter of all female dogs will develop it by the age of 10. It's a serious medical emergency, and spaying is the definitive cure and prevention. Similarly, spaying prevents other hormone-mediated issues like vaginal hyperplasia. For male dogs, castration or the removal of the testicles carries similar direct benefits. It eliminates the risk of testicular cancer, which is the second most common site for tumors in intact male dogs. It also serves as a prophylactic and therapeutic measure for a host of androgen-dependent diseases that become common as male dogs age. Chief among these is benign prostatic hyperplasia, or BPH, an enlargement of the prostate gland. By 5 years of age, half of all intact male dogs show evidence of BPH, which can lead to discomfort, difficulty with urination and defecation, and secondary infections like prostatitis. Castration is a very effective treatment for these conditions. It also cures over 90% of dogs with perianal gland tumors, which are influenced by testosterone. So, the case for neutering seems strong and straightforward when viewed through this lens. It tackles a major societal problem, prevents deadly diseases of the reproductive tract, and has been the standard of care for generations. For many years, this was where the discussion ended. However, as researchers began to conduct long-term studies and look beyond the reproductive system, a much more complicated picture began to emerge. The very hormones that drive reproduction, it turns out, play a role in nearly every system of the body, from the skeleton to the immune system to the brain. And removing them, especially early in life, isn't without consequences. The big C, a complicated relationship with cancer. One of the most powerful arguments historically made in favor of spaying female dogs is the profound reduction in the risk of mammary tumors, the canine equivalent of breast cancer. Mammary neoplasia is the most common form of cancer in sexually intact female dogs, particularly in European countries where early neutering is less common. The data supporting this benefit has been compelling for decades. One of the most frequently cited studies found that a female dog's lifetime risk of developing a malignant mammary tumor is a mere 0.5% if she is spayed before her first heat cycle. If she is spayed after her first heat, but before her second, that risk climbs to 8%. After the second heat, the risk jumps to 26%, which is a significant increase compared to being spayed early. After about 2.5 years of age, the protective benefit of spaying against malignant tumors seems to be largely lost. This evidence has formed the bedrock of recommendations for early spaying for generations of veterinarians. However, in science, even long-held beliefs must withstand modern scrutiny. A systematic review published in 2012 took a hard look at the body of research on this topic and came to a surprising conclusion. After screening over 11,000 articles, the authors found that the evidence supporting the recommendation of early spay to prevent mammary tumors was actually weak. This wasn't necessarily because the original conclusions were wrong, but because the studies themselves, many of which are over 40 years old, had methodological flaws when viewed through a modern epidemiological lens. They often failed to properly account for confounding factors like the dog's age, breed, and other treatments, which we now know can heavily influence cancer risk. This critique highlights a broader issue in veterinary research. Our understanding is constantly evolving, and what was once considered settled science can be called into question as our research methods improve. It's also worth noting that mammary cancer is generally a disease of older dogs, often developing between 9 and 11 years of age, whereas some of the risks associated with neutering, which we'll discuss next, can affect dogs much earlier in life. While the debate over mammary cancer continues, the picture for other cancers is becoming clearer, and in some cases, more alarming. We are now learning that for several types of aggressive cancers, neutering doesn't decrease the risk, it actually appears to increase it. Let's start with osteosarcoma, a highly malignant and aggressive bone cancer that predominantly affects large and giant breed dogs. Multiple studies have found a significantly increased risk in neuter dogs compared to their intact counterparts. One study found that neuter dogs had a 2-fold increased risk of developing osteosarcoma compared to intact dogs. The timing of the procedure seems to be critical. A landmark study on Rottweilers, a breed with a high predisposition for this cancer, delivered a stark warning. It found that dogs of either sex neutered before 1 year of age had approximately a 1 in 4 lifetime risk of developing bone sarcoma. This was a significantly higher risk than that for dogs who remained intact. This suggests that the early removal of gonadal hormones during a critical period of skeletal development leaves these dogs more vulnerable to this devastating disease. Another cancer of great concern is hemangiosarcoma, an aggressive cancer that arises from the cells lining blood vessels. It can appear in the spleen, heart, or skin. Again, studies have linked neutering to a higher risk, especially in certain breeds. A large review of golden retrievers found that female dogs spayed after 1 year of age had a risk of being diagnosed with hemangiosarcoma that was 4 times greater than that of intact females. An even more striking finding came from a study on Vizslas. In that breed, spayed females were found to be 9 times more likely to develop hemangiosarcoma compared to intact females. The risk for cardiac tumors, particularly cardiac hemangiosarcoma, is also elevated. One study found that the risk for spayed females was more than 5 times greater than for intact females, and castrated males also had a slightly increased risk. The list continues with lymphoma, one of the most common cancers diagnosed in dogs. A large study found that intact female dogs were about half as likely to develop lymphoma compared to spayed females or any male dogs, whether intact or neutered. Breed-specific studies have echoed these findings. In both golden retrievers and Vizslas, neutering was found to increase the risk of lymphoma by approximately 3 to 4 times. For male golden retrievers specifically, early castration, before the age of 1, tripled the risk for developing this cancer. Then there is the case of prostate cancer. In human medicine, prostate cancer is known to be androgen-dependent, meaning it is fueled by testosterone. Therefore, treatments often involve blocking testosterone. It was long assumed the same held true for dogs. However, research has turned this assumption on its head. Several studies have now shown that castrated male dogs have an increased risk of developing prostatic carcinomas, ranging from a 2 to 8 times greater risk compared to intact males. While the overall prevalence of prostate cancer in dogs is very low, estimated at less than 1%, this finding is a crucial piece of the puzzle, suggesting that sex hormones may have a protective effect against certain types of cancer, and their removal can have unintended consequences. Finally, we see an increased risk for transitional cell carcinoma, a cancer of the urinary bladder. Studies have shown that neutering can increase the risk up to threefold in both male and female dogs. This information can feel overwhelming and contradictory. On one hand, spaying drastically reduces the risk of the most common cancer in intact female dogs. On the other hand, neutering seems to raise the risk for a host of other serious, often aggressive cancers in both sexes and in specific, beloved breeds. This is the central dilemma that veterinarians and pet owners now face. It's a complex risk-benefit analysis where the overall incidence of each cancer must be considered. Markedly increasing the risk for a rare cancer may be an acceptable trade-off for preventing a common one. But for breeds with a known high risk of cancers like osteosarcoma or hemangiosarcoma, such as Rottweilers and Golden Retrievers, the decision becomes much more fraught with difficulty. This is precisely why the conversation has shifted from a blanket recommendation to a deeply personal one. The framework: impact on bones and joints. Beyond the complex world of cancer, one of the most significant and well-documented areas of concern regarding early neutering is its impact on a dog's musculoskeletal system. For many owners of large and active breeds, this is a topic of paramount importance, as joint disorders can lead to a lifetime of pain, reduced mobility, and costly medical interventions for their dogs. To understand how neutering affects bones and joints, we need a quick lesson in canine physiology. The sex hormones, estrogen and testosterone, do more than just govern reproduction. They are powerful signaling molecules that play a vital role in regulating growth and development throughout the body. One of their crucial jobs is to manage the closure of the growth plates in the long bones of the legs. Growth plates are areas of cartilage near the ends of bones where new bone tissue is generated, allowing a puppy to grow. As a dog approaches maturity, gonadal hormones send the signal for these growth plates to close, solidifying the bone and ending the growth process. When a dog is neutered before puberty, this hormonal signaling system is disrupted. Without the influence of estrogen or testosterone, the closure of the growth plates is delayed. This means the long bones continue to grow for a longer period than they were genetically programmed to, resulting in a dog that may be slightly taller and leggier than if it had been allowed to mature naturally. While this might not sound like a major issue, this subtle change in bone length can alter the geometry and alignment of the joints. This altered conformation can put abnormal stress and strain on the joints, potentially predisposing the dog to a range of orthopedic problems. The evidence for this link is particularly strong for some of the most common and debilitating joint disorders. This includes hip dysplasia, elbow dysplasia, and cranial cruciate ligament tears or ruptures, often abbreviated as CCLR, which is similar to an ACL tear in humans. Multiple studies focusing on specific large breeds have highlighted these risks. Initial research on Golden Retrievers, Labrador Retrievers, and German Shepherd dogs found that the risk of developing one or more of these joint disorders was increased severalfold for dogs neutered before 1 year of age, compared to dogs that remained intact. For instance, some large breeds suffer a heightened likelihood of these problems if they are neutered before 1, or sometimes even 2, years of age. Male Bernese Mountain Dogs, Labrador Retrievers, and Rottweilers also experience heightened risks for joint disorders with early neutering. The same is true for female Australian cattle dogs, Dobermans, Labrador Retrievers, Rottweilers, and St. Bernards. This concern isn't limited to purebred dogs. To provide guidance for the millions of mixed-breed dogs, researchers evaluated data based on their adult body weight. The results were clear. For mixed-breed dogs, both male and female, that are expected to weigh at least 20 kilograms, or about 44 pounds, in adulthood, neutering before 1 year of age was associated with an elevated risk for joint disorders. For smaller mixed-breed dogs, those expected to weigh less than 20 kilograms, early neutering did not appear to increase this risk. This gives us a crucial principle. For larger dogs, allowing the joints to fully develop under the influence of natural hormones appears to be protective. This is why many veterinarians and breed experts now suggest waiting until a large breed dog is at least 1 year old, or in some cases, has gone through their first heat cycle for females, before considering the surgery. This delay allows the growth plates to close naturally, hopefully reducing the risk of these painful and life-altering orthopedic conditions. Of course, this creates a practical dilemma for owners. Waiting to neuter means managing an intact animal, which comes with its own set of challenges, from preventing unwanted pregnancies to handling the behavioral changes associated with hormonal cycles. It once again underscores that the decision is a trade-off. By delaying neutering to protect the joints, an owner might be taking on other risks, such as the increased chance of mammary tumors we discussed earlier. It is this balancing act that makes the personalized conversation with a veterinarian so incredibly important. For owners of smaller breeds, such as Boston Terriers or Shih Tzus, the risk of joint disorders from early neutering is generally not a concern, though these breeds may have elevated cancer risks to consider. Conversely, for the owner of a future 100-pound Mastiff, delaying the surgery to reduce the risk of a joint disorder might be the top priority, even if it means a more complex surgery later on. The behavior question: myths and nuances. Perhaps one of the most common reasons owners choose to neuter their dogs, beyond population control, is the belief that it will solve or prevent behavior problems. The procedure is often marketed as a simple fix for aggression, hyperactivity, and a host of other undesirable behaviors. And while neutering does have a definite impact on certain behaviors, the reality is far more nuanced and complex than popular belief suggests. Many behaviors that owners find challenging have little to do with sex hormones, and in some cases, neutering can even make things worse. Let's start with what neutering reliably does affect. The behaviors that are most directly and consistently influenced by gonadectomy are those that are sexually dimorphic, behaviors that are expressed differently in males and females, and are strongly driven by hormones. For male dogs, this includes roaming in search of females in heat, mounting behavior, and urine marking. Studies have shown that castration is effective at reducing these specific behaviors. For females, spaying eliminates the hormonal fluctuations of the heat cycle, and with it, the associated behaviors like bleeding, receptiveness to males, and potential moodiness. For owners who find these behaviors inconvenient or difficult to manage, neutering can provide significant relief. However, the conversation becomes much more complicated when we talk about aggression. Many people believe that testosterone is the sole driver of aggression in male dogs and that castration is a guaranteed cure. This is a significant oversimplification. Aggression is a complex behavior with many potential causes, including fear, anxiety, genetics, lack of socialization, and learned experiences. It is not a simple male sexual behavior. While testosterone can lower the threshold for aggression in certain situations, it is rarely the only factor. As a result, studies have found that castration only reduces aggression in a minority of male dogs. It may have some effect on aggression towards other dogs, but less so on aggression towards people. More concerning is the growing body of evidence suggesting that in some cases, neutering can actually increase aggression and fear-related behaviors. One study reported that for female dogs who were already showing signs of aggression, spaying them before they were 1 year old actually increased the risk of dominance aggression towards family members. Another found that neutered dogs of both sexes may be more prone to stranger-directed aggression. The mechanism behind this is not fully understood, but it's hypothesized that the removal of sex hormones, which can have a calming or confidence-boosting effect, may unmask or exacerbate underlying anxiety and fear. This can lead a dog to react more defensively or aggressively in situations it finds threatening. Fear and anxiety in general appear to be linked to neuter status. Several studies have reported that neutered dogs are more likely to exhibit fear-based behaviors, noise phobias, and separation anxiety compared to intact dogs. One large-scale study on visual loss found that neutered dogs were more likely to develop behavioral disorders like fear of storms. Another study reported that for every 1-month decrease in the age at neutering, the odds of developing a noise phobia increased. Conversely, the same study found that early-age neutering was associated with a decrease in separation anxiety and urination when frightened, highlighting the complex and sometimes contradictory effects. The impact on trainability is another area of active research. While some believe that neutering a dog makes it calmer and more focused, this is not always the case. One fascinating study was conducted on German Shepherds being trained as police dogs for narcotics detection. The researchers found that intact males were significantly more trainable and performed better on detection tasks than neutered males. Similarly, intact females outperformed their neutered counterparts. The study suggested that gonadectomy had adverse effects on their training and performance. This could be due to castration having a negative influence on the behavior of dogs, perhaps making them more anxious or less confident in their work. This body of research challenges the long-held notion of neutering as a behavioral panacea. It shows us that for non-reproductive behaviors, the effects are unpredictable and highly individual. Neutering an already fearful or anxious dog in the hopes of calming it down may backfire, potentially increasing its reactivity. It underscores the importance of addressing behavior problems through training, socialization, and environmental management, rather than relying on surgery as a first-line solution. When an owner is considering neutering for behavioral reasons, it is crucial to have a thorough discussion with a veterinarian or a veterinary behaviorist to understand what the procedure can and cannot achieve, and to weigh the potential for unintended negative consequences on the dog's behavior. A modern approach, personalization, is key. As we've journeyed through the science of neutering, from its role in population control to its intricate connections with cancer, orthopedics, and behavior, one overarching theme has become abundantly clear. There is no longer a universal, one-size-fits-all rule for when, or even if, a dog should be neutered. The era of the standard 6-month spay/neuter recommendation is giving way to a new paradigm, one that is built on personalized assessment and a collaborative dialogue between the pet owner and the veterinary team. The decision-making process today is about weighing a complex set of variables that are unique to each individual dog. It's a personalized health plan, not a routine procedure. The most critical factors to consider are the dog's breed, sex, and expected adult body size, as these heavily influence the risk profile for various diseases. Let's summarize what the research tells us about specific breeds and sizes. For some large and giant breeds, the evidence pointing toward a higher risk of joint disorders and certain cancers with early neutering is substantial. Breeds like Golden Retrievers, Labrador Retrievers, and German Shepherds have been shown to have a significantly increased risk of hip dysplasia, elbow dysplasia, or cranial cruciate ligament rupture if neutered before 1 year of age. For German Shepherds, the recommendation might even be to wait until they are 2 years old. For Golden Retrievers, we see an elevated risk of lymphoma and hemangiosarcoma with neutering, and the timing matters. For Rottweilers and Dobermans, the specter of osteosarcoma and urinary incontinence, respectively, looms large in the decision-making process. Conversely, for most small breed dogs, the risk of joint disorders associated with early neutering is generally not a concern. Shelters can continue to perform very early neutering on puppies that are expected to remain small without the fear of elevating these specific orthopedic risks. However, even small breeds are not entirely exempt from potential downsides. For example, studies have shown increased cancer risks in neutered Boston Terriers and Shih Tzus. And then there are breeds that appear remarkably resilient. Studies on Siberian Huskies and Rhodesian Ridgebacks, for instance, found very low incidences of both joint disorders and the cancers studied, suggesting that for these breeds, neutering after 6 months of age is a reasonable choice without increasing these particular health risks. For the millions of beloved mixed-breed dogs, the guiding principle is body weight. As we discussed, if a mixed-breed puppy is expected to grow to be more than 20 kilograms, or about 44 pounds, waiting until at least 1 year of age to neuter is advisable to avoid increasing the risk of a joint disorder. For smaller mixed breeds, this concern is lessened. This breed and size-specific data is the foundation of the modern approach. But the conversation doesn't stop there. The dog's entire living situation and the owner's lifestyle and preferences must also be factored into the equation. For instance, what is the dog's intended purpose? A highly athletic dog destined for performance sports like agility might have different considerations regarding joint health than a more sedentary companion animal. What is the owner's ability to manage an intact animal? Can they reliably prevent unwanted breeding and manage the behaviors associated with heat cycles? This is where the practitioner's dilemma truly comes into play. The veterinarian must now weigh all this information and present it to the owner in a clear, unbiased way. They must discuss the pros and cons for that specific animal. For example, they might say, for your female Golden Retriever, spaying before her first heat will dramatically reduce her risk of mammary cancer. However, doing so will also significantly increase her risk of a cruciate ligament tear and potentially lymphoma. If we wait until she is over 1 year old, we slightly increase the mammary cancer risk, but we protect her joints. What are your priorities and concerns? It's also crucial to distinguish between recommendations for an owned pet versus an animal in a shelter or a rescue setting. For unowned animals, the public health benefit of preventing overpopulation through neutering likely outweighs any potential increase in individual cancer risk. The immediate need to control the population is paramount in that context. But for a cherished pet in a responsible home, the focus shifts to maximizing that individual's lifelong health and well-being. This new approach requires more from both veterinarians and pet owners. It requires veterinarians to stay current with a rapidly evolving body of research and to be skilled communicators. It requires owners to be engaged partners in their pet's healthcare, to think critically about their own circumstances, and to understand that there is often no single right answer. Beyond the traditional, other health factors and future directions. As we round out our deep dive into the world of spaying and neutering, it's important to touch upon a few other health considerations and to look ahead at alternative options that are becoming more available. The effects of removing sex hormones ripple through the body in ways we are still discovering. One of the most common and frustrating side effects of spaying in female dogs is urinary incontinence. Specifically, a condition known as hormone-responsive or sphincter mechanism incompetence can develop. This occurs because estrogen plays a role in maintaining the muscle tone of the urethral sphincter, which controls the flow of urine. When the ovaries are removed and estrogen levels drop, this sphincter can weaken, leading to involuntary leaking of urine, often while the dog is sleeping or relaxed. The incidence varies widely in studies, from as low as 3% to as high as 21% of spayed females. The risk is influenced by several factors. Heavier dogs are more susceptible. Those weighing over 20 kilograms or 44 pounds have a risk of up to 30%. Certain breeds also have a known predisposition, including boxers, Dobermans, Old English sheepdogs, and Rottweilers. The timing of the spay may also play a role, though the evidence is somewhat conflicting. While this condition is often manageable with lifelong medication, it can be distressing for owners and can impact the human-animal bond. Another major health concern linked to neutering in both dogs and cats is obesity. Epidemiological studies have consistently shown that neutered animals are significantly more likely to become overweight or obese than their intact counterparts. The mechanism is twofold. Gonadectomy often leads to an increased appetite and a simultaneous decrease in the animal's metabolic rate and activity level. It's a perfect storm for weight gain. This is not just a cosmetic issue. Obesity is a major risk factor for a cascade of other chronic diseases, including painful orthopedic conditions like osteoarthritis, diabetes mellitus, and even some types of cancer. It also puts a financial and emotional burden on pet owners. Preventing obesity after neutering requires diligent management from the owner, including carefully controlled feeding portions, not free feeding, and a commitment to regular exercise. The immune system is another area where sex hormones appear to play a modulating role. Research has suggested that the reproductive and immune systems are highly interdependent. One retrospective study found that neuter dogs had a significantly greater risk of developing several immune-mediated diseases, including atopic dermatitis, autoimmune hemolytic anemia, hypothyroidism, and inflammatory bowel disease, when compared to intact dogs. This is a promising but complex area of research, and it suggests that neutering may have far-reaching effects on the body's ability to regulate its immune responses. With all these potential risks, it's natural to wonder about the overall effect on a dog's lifespan. Here, the data is intriguing and, at first glance, seems to favor neutering. Several large studies have documented that, on average, neutered dogs live longer than intact dogs. One study found that spayed females lived 26% longer and castrated males lived 14% longer. However, we must look closer at the causes of death. The same study revealed that while neuter dogs were less likely to die from infectious diseases or trauma, likely because behaviors like roaming are reduced, they were more likely to die from cancer and immune-mediated diseases. This longevity data can also be skewed by what researchers call selection bias. Many of these studies are based on records from veterinary teaching hospitals. Pet owners who can afford to neuter their dogs may also be more likely to afford treatment for serious diseases later in life, creating a perception that neutered animals live longer simply because they receive more advanced medical care. Given the growing awareness of these potential long-term complications, there is increasing interest in alternative methods of sterilization that can prevent reproduction while preserving the dog's natural hormonal state. These are often called gonad-sparing surgeries. For male dogs, this is a vasectomy, a simple procedure where the vas deferens is cut or tied, preventing sperm from being ejaculated but leaving the testicles intact to produce testosterone. For females, the equivalent is a hysterectomy, or removal of the uterus, while leaving the ovaries in place. This prevents pregnancy, but allows the female to continue producing estrogen and to go through heat cycles, though without the bleeding. These procedures effectively sterilize the animal, addressing the population control issue, without the systemic health consequences associated with removing the gonads. While they are not yet widely available, More veterinarians are beginning to offer these options as owners become more educated about the lifelong role of sex hormones. As we conclude, it's clear that the decision to neuter is one of the most significant choices a dog owner will make, with implications that extend far beyond preventing puppies. It's a decision that sits at the intersection of public health, individual animal welfare, and evolving science. The simple answers of the past are no longer sufficient. Today, the best decision is an informed one, made thoughtfully and carefully, based on the unique characteristics of your dog and in close partnership with your veterinarian. It's about personalizing medicine for our canine companions, ensuring that we are not just extending their lives, but also enhancing the quality of those years we are so privileged to share with them. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.